Currently, Nigeria is facing multiple burdens of malnutrition, including undernutrition, overnutrition, micronutrient deficiencies, as well as diet-related non-communicable diseases. Poor quality diets are the main cause of malnutrition. Therefore, worldwide nutritionists are forging multi-sector partnerships to ensure that our food systems provide good quality and healthy diets. One effective way of improving the diets and addressing the multi-burdens of malnutrition at the same time is the consumption of fruits and vegetables. Fruits and vegetables are found in large variety and abundance in Nigeria. However, the consumption of these gifts of nature have been reportedly low in Nigeria. This project aims at addressing malnutrition among low-income urban population in Nigeria and Vietnam by increasing intake of fruits and vegetables through food system innovations that improve access through the diversification of retail outlets, enhance affordability through a client-specific coupon system, and boost acceptability through promotional campaigns and behavior change communication. The project was implemented at the same time in Ibadan, Nigeria, and Hanoi, Vietnam.
This project was funded by Bill and Melinda Gates Foundation and coordinated by the Wageningen University in the Netherlands. It involved many partners including the University of Ibadan, Biodiversity International, SEAT, IFPRI, the Hanoi Medical University, National Institute of Nutrition in Hanoi, as well as Ricoto.
We kicked off in 2019 with a selection of two communities in Ibadan, Bagadaye and Abeja, located in Akinyele local government area. 1,200 households were listed in the communities and a total of 600 eligible households were recruited for the study. And within the household, eligible study participants were non-pregnant females of reproductive age, that means 18 to 49 years old, and also we recruited the adult males within their households.
So we started off with Work Package 1, which consisted of a series of studies, baseline studies, to give us the needed information for the project interventions. So after the community entry, we first of all carried out a seasonality study, which consisted of a series of focus group discussions in the community. In these focus group discussions, we explored the diversity, sources, seasonal availability and preferences of fruits and vegetables in these communities, so as to gain a deeper understanding of the influence of seasonality on fruit and vegetable consumption in the area.
Affordability has been associated with low consumption of fruits and vegetables, particularly in low-income households.
So secondly, we conducted a barrier analysis study where we tried to understand drivers and barriers to the consumption of fruits and vegetables in the communities. So next we had to do a household baseline survey between March and April 2019, where we tried to get information on household characteristics, dietary intake, anthropometry, and other data that is related to nutrition and markets in the area. Then after that, we moved into the markets for the market level assessment. We did this among so many retailers so that we could understand how retailing dimensions could help us to understand the possible pathways to change fruit and vegetable intake among the study population. So this involved 87 retailers from within the study communities, that is Abaeja and Bagadaje, as well as 180 from the two major markets around that area, which is Ojo and Moniya. We did this market level assessment in 4 phases. We had the scoping exercise, the retailer census, the main market level survey, as well as the measures or the weight conversion survey.
Well equipped with the wealth of data collected in the preliminary and baseline surveys, the research team proceeded to plan and implement project intervention activities known as Work Package WP2. The key tripartite intervention priorities were improving accessibility through consumer-focused retail innovations WP2A, enhancing affordability using price incentives and motivation WP2B, and promoting acceptability through communication and information dissemination on the benefits of eating fruits and vegetables, WP2C. The intervention designs emphasized the use of co-creation as a science-based action learning process which allows for joint reflection, learning and innovation among researchers and research participants.
Work Package 2A was a consumer-responsive retail intervention which addressed issues around the point of sale of fruits and vegetables. We worked with several retailers and vendors during the market-level assessments in a co-creative process, and we also trained these vendors over a period of about 24 weeks. This was the rallying cry for our vendors during these co-creation workshops. So the main questions we asked vendors was what can be done to make customers buy more fruits and vegetables. We put their answers together during the co-creation process, and we ended up with 3 timed cycles of interventions that came out of this process. Innovations such as branded pallets, umbrellas, vegetable hangers, stepwise counters and aprons were designed, produced and distributed to the vendors. Innovations were bespoke, which means that they were customized according to the vendor's request and validated need. In addition, vendors participated in training sessions on bookkeeping, hygiene, customer service and product display. Detailed records of sales of fruits and vegetables were collected weekly from March to October 2021.
Èmi tó pa àwọn tí ó wà tí wọ́n ṣe máa wá tán máa ń lọ ni. Mọ̀gbà tó dé ìyàtọ̀ dé pé wà ìgbà tá a wá síbẹ̀. A ṣáà rí pé wọ́n ń dá wa lóríṣiríṣi ìdánilẹ́kọ̀ọ́ àwọn nǹkan tí ò yé wa. Wọ́n ń jẹ́ kó yé wa nípa bó ṣe yẹ ká máa ṣèmọ́tótó, bó ṣe yẹ kí ká máa jẹ́ ká jẹ ìpín 5 èso àtewébẹ̀ dáadáa bó ṣe ń ṣara lóore àwọn àǹfààní tó wà nínú rẹ̀. Wọ́n dẹ̀ ń kọ́ wa bó ṣe yẹ ká máa ṣe sí àwọn oníbàárà wa láti lè jẹ́ kí wọ́n lè máa patronize wa láti máa bá wa rajà. Ká sì máa sọ ìwúlò tó wà láàrin kéèyàn máa jẹ ìpín 5 èso àtewébẹ̀.
Àkọ́kọ́ ni pé ìgbà tí a kọ́kọ́ bẹ̀rẹ̀ tẹ́kọ́ fún wa ní umbrella yẹn tó ká tí mo bá ti tò tí mo bá ti sẹ́tẹ̀ tí mo ṣe sí àwọn èèyàn wọ́n máa béèrè pé umbrella yìí tún ṣe kíní ká wọ́n rírú ẹ̀ ní ọ̀dọ̀ lágbájá náà àwọn rírú ẹ̀ lọ́dọ̀ tàmọ̀dọ̀ náà mo máa ń ṣàlàyé fún ìpè àwa ti ń ṣe ẹgbẹ́ eléso nínú UI náà ti wá ń fún àwa ní ìdánilẹ́kọ̀ọ́ oríṣiríṣi nǹkan náà dẹ̀ mọ́ bá wa sọ nípa èso àtewébẹ̀ táǹtà o so ọlọ́jẹ́ kí àwọ̀ ó ní advance.
bàtà àgbà apron tán wọ́n ń kan tí ń bẹ èso àtewébẹ̀ ń sara lórí kíní kan lẹ́yìn ẹ̀ tá a tún wá gba umbrella níbi umbrella là ń lọ a ní kán bá wa fi logo sí wọ́n bá wa ṣe sí ó mú kí àwọn èèyàn máa wá bá wa rajà ju àwọn oníkiri lọ wọ́n á ní àwọn ń lọ ibi tí umbrella wa bóyá wọn ó tiẹ̀ fún alẹ́ bùn ni bóyá kíní kan ní kankan wọ́n ṣàn ọjà sáà ìyá nígbà yẹn.
Work Package 2B involved a randomized control trial that was designed to test the extent to which affordability was a major barrier to increasing fruit and vegetable intakes and whether receiving vouchers can change consumption habits among consumers.
This aspect of our study sought to answer the question, will consumption habits change after a long period of receiving coupons? Fruits and vegetable coupons were distributed to 400 households for 22 consecutive weeks. A coupon was worth 200 naira. However, 200 households got 400 naira worth, while the remaining households got 800 naira worth. The grouping of households into either 400 or 800 naira worth was done by random selection. Participants were only allowed to receive mandated fruits and vegetables indicated on the coupon. We worked with microfinance institution called Capital State Technology, both on developing a coupon management system and for redemption. Capital Sage provides an interesting repayment method as their agents circulate in Ibadan, acting as mobile points of sale terminals for basic transactions. Logging coupons on the system with their mobile phone, the reimbursement value is transferred to the vendor's mobile wallets. Vendors can cash out their mobile wallets by visiting Capital Sage agents in the market. A USSD code was employed for the redemption of the coupons, while the vendor had to follow the direction of the USSD code to authenticate and log the consumer's coupon and further claim their monies from a financial institution after verification from the latter.
Orúkọ mi ni Oyètúnjí Emmanuel Olúwa. Olúwaṣẹ́gun. A wà ní agbègbè Ìjẹ̀fún ní Abẹ́ẹ̀jà. Gbogbo ìpàdé tẹ́ ẹ pè wá sí tá a jọ jíròrò lé lórí, tá a jọ fohùn ṣọ̀kan lórí àwọn tá a jọ fohùn ṣọ̀kan lé lórí títí di ìgbà títí yẹn kásẹ̀ nílẹ̀ nígbà gbogbo nǹkan yẹn pátá ìní ẹ fi sí ojú ìṣe tẹ́ ẹ lò ní àkókò yẹn. Bẹ́ẹ̀ ni mo ṣàkíyèsí àwọn ọlọ́jà tẹ́ ẹ bá ṣe ìpàdé tẹ́ ẹ sì bá sọ̀rọ̀ nípa èso àti ewébẹ̀, nípa bí wọ́n ṣe ń ta èso wọn, bí wọ́n ṣe gbé kalẹ̀ àti àwọn nǹkan tí mo rí tẹ́ ẹ gbé fún wọn gan tẹ́ fi ń pàtẹ èso àti ewébẹ̀ yẹn. A di àǹfààní ẹ̀ ọ̀sẹ̀ọ̀sẹ̀ ni ìyàwó mi sì máa ń láǹfààní láti lọ fi kùpọ́ọ̀ yẹn gba èso oríṣiríṣi wá sílé fún wa tá a máa ń jẹ. Èmi gẹ́gẹ́ bí ẹnìkan àti ìdílé mi ó mú ìyàtọ̀ bá jíjẹ èso àti ewébẹ̀, pàápàá jùlọ ó ti sọ mí di ẹni tèmi náà ní ọgbà ewébẹ̀ tèmi lọ́tọ̀.
Orúkọ mi ni Ìyáàfin Victoria Bọ́sẹ̀ Oyèkúnlé. Àdúgbò tá a wà ní Àjọdá Bagada jẹ́ nílùú Mọ́níyà. In fact, kò sí àmọ̀ràn tá a fún yín tẹ́ ẹ lò torí ẹ ṣe dáadáa gan. Mo gbọ́ ti àwọn tí wọ́n béèrè àbéèrè, mo sì gbọ́ ti àwọn tó jẹ́ pé wọ́n kọ orin fún wa bí èso ṣe dára sí. Gbogbo àwọn prógrámù yẹn pátá ni mo gbọ́.
Èso àti ewébẹ̀ ń ṣara lóore. That is, fruits and vegetables are beneficial for the body, such as the slogan that rang popularly among our study participants. This was one of the outputs of Work Package 2C, which was the third intervention arm of the study. The project team worked with residents of Abaeja and Bagadaje to co-create promotional campaigns to raise the acceptability of fruits and vegetables among low-income residents in Ibadan.
At the start of this project, we did a barrier analysis which revealed a low awareness of the importance of daily fruit and vegetable consumption in the focal neighborhoods in Ibadan. Now, in this context, there is a good chance that the promotional campaigns that we implemented will encourage more of adequate fruit and vegetable consumption, and this was the rationale behind Work Package 2C. In the design, approximately 20 residents from our study were engaged in the co-creation process. In dialogue with researchers through a series of workshops, participants helped us design locally relevant activities and targeted messaging for promotional campaigns to encourage their neighbors, families, friends, etc. to eat more fruits and vegetables. Now, the campaigns involved several activities and message sharing. We distributed leaflets and posters and teaching aids for the schools and organized activities such as dramas, public service announcements, jingles, and expert talks on popular radio stations. Now, especially for radio, the radio spots have reached audiences across Ibadan, even beyond our target group, sparking awareness on the benefits of consumption as well as the WHO recommended 5-a-day intake for fruits and vegetables. And indeed, these campaigns contextualize the recommendation to our local context. Schools were not left out, especially. We developed models on communicating the consumption of fruits, and these were taught in classes. The students were involved in a competition to create jingles to communicate and promote the consumption of fruits and vegetables within their communities, and these were played and judged on radio by a mixed panel of study participants and local researchers. And we also involved these students in a competition where they created drama that were presented to members of their community to reinforce these messages.
The third intervention came to an end in October 2021, and an endline survey was conducted afterward between November and December 2021 to assess the impacts of these interventions in the research communities.
While all the various interventions were being implemented, a dietary assessment monitoring survey was done every 2 months to keep track of participants' consumption before the final endline survey to evaluate the impact of the interventions. Finally, during the last 3 months of 2021, the endline survey was carried out in 4 communities. The 2 experimental communities, namely Abeja and Bagadaje, as well as 2 others to serve as control. 2 communities, namely Ari-Ibi and Akpete, were added to serve as a control experiment, both having similar characteristics to the experimental group. House listing was done and 200 households were recruited in the control communities. The endline survey replicated the baseline survey, but included other questions related to the 3 interventions.
The project, titled Increasing Fruit and Vegetable Intake of Low-Income Population in Vietnam and Nigeria through Food System Innovations, was a huge endeavor, fondly referred to as FRUGGIES, that is, fruits and vegetables. In Nigeria, the project duration spanned several seasons, national holidays, and also events such as national elections, mass protest, and conflict, as well as the global COVID-19 pandemic. However, through it all, the team worked collaboratively with the communities and the ever-supportive international partners to achieve all the project objectives.
We had a fantastic research team, which spanned disciplines and multiple stakeholders. This was really necessary for inclusivity and so that we could locally contextualize all our transformative food systems research. So although we're so different, we had similar values in our team, and our values include excellence, hard work, tenacity, and discipline. To us, what mattered was doing the work well.
The study results, which will be disseminated in various fora, will provide valuable insights into how locally designed food system innovations can help to increase fruit and vegetable consumption and therefore promote healthier diets among low-income population in Nigeria and Vietnam.
Èso àti ewébẹ̀, ó ń ṣara lóore, ó ń ṣara lóore.
Èso àti ewébẹ̀, ó ń ṣara lóore.